Hey everybody, talking a little bit more about how to know if it's not an ingrown toenail. There's quite a few different differential diagnoses when it comes to ingrown toenails. We don't want to miss any. One of the more common ones that I see is that it could be a subungual exostosis. And there's a really simple test to look here and assess if this is the case. Basically, when you're looking at that ingrown toenail, there's going to be pain around the nail, whereas for a subungual exostosis, you're going from that distal or apex of the hallux and really starting to push against it. If it's feeling full or thick, like there's the bone underneath, which is what we're looking at here, then that's where it may be a subungual exostosis. You haven't touched the nail in any way, and yet they're still getting pain. Similarly, you might be able to push on the top dorsal aspect of the nail, and that's causing pain as that nail presses down on the skin and very quickly onto the underlying bone. Another concern could be a foreign body. It may have got into the sulci or the edge of the nail, could be causing pain in that way. There could be something further in there, and that's where it might be more likely a foreign body than an ingrown toenail. There's other options like osteochondromas, which are a benign, cartilaginous growth off of the, the area at the distal phalanx of the hallux or the big toe, and that could be causing concerns. And these are very, typical to come up as like a calloused area around the nail. They'll typically, be in a very small sort of circle appearance, and they may be coming out any different way. And when you're looking at it and you're saying, well, it doesn't look like an ingrown toenail, this could be what it is instead. I've also seen gout of the IPJ look somewhat similar to an ingrown toenail, but when you look a little bit closer, it's not necessarily around the toenail, it's more around that interphalangeal joint at the big toe. That's where it's red, hot, swollen, there's pain on joint compression or when putting any range of motion through there. On x-rays, you tend to see a little bit more joint degeneration in later stages, and so that's where you can really start to get an idea of, okay, what is this? And in that case, it might be gout. I've also seen patients that have come through, and some of my colleagues as well, that have got iatrogenic or post a previous procedure osteomyelitis or bone infection, and that can be quite concerning because over the top of the nail it looks very good, it's nice and clean and clear, but underlying at the bone level there can be some osteomyelitis, and doing another procedure for what you think might be a ingrown toenail is not the best option here. This is where we need a little bit more of a further think about it, and particularly if you're doing more than one procedure for an ingrown toenail, or there's been infection in the past that you're concerned about might have been a bit deeper, I'd definitely be looking to an x-ray if it's in the longer term, or if it's in the short term, potentially to a CT or MRI. But hopefully this gives you a little bit of a further guidance and in how to know if it's not an ingrown toenail. If you like this video, hit the subscribe button, have a look at some of our other videos, and we'll see you in the next session. Cheers.